Folks, welcome back. If you're new around here, my name is Kweku and I'm a pharmacist. Today we'll be discussing the topic diabetes and foot problems. Foot problems are fairly common in people with diabetes, and if left unchecked, it may lead to a potential loss of a toe, a foot, or sometimes even a leg. One of the problems with diabetes is that over time, there is a tendency to lose feeling in your feet or your toes. It's relatively easier for you to have an ulcer or a blister that you don't realize. And such an ulcer, if not well managed, may become infected or may lead to the formation of gangrene, which ultimately may result in amputation just to save the life of the person. This is further aggravated by the fact that diabetes also can lower the amount of blood flow in your feet. Not having enough blood flowing to your legs and feet can make it hard for a sore or an infection to heal, and thereby further compounding the problem. So today I'm going to provide some tips as to how to take care of your feet if you are diabetic, and let's dive straight into it. The first is to check your feet every day. You may have foot problems but feel no pain in your feet. Checking your feet every day will help you spot problems early before they get worse. A good way to remember to check your feet is to do it each evening when you take off your shoes. Most importantly, check between your toes. If you have trouble bending over to see your feet, try using a mirror to see them or ask someone else to look at your feet. Look for problems such as cuts, sores, or red spots, swelling or fluid-filled blisters, ingrown toenails in which the edge of your nail grows into your skin, corns or calluses, which are spots of rough skin caused by too much rubbing or pressure on the same spot. Check out also for plantar warts, which are flesh-colored growths on the bottom of the feet. It's generally a good idea to cover blisters or cuts with a bandage. The next tip is to wash your feet with soap in warm water daily. And we say warm water, not hot water. It's very important that you test the water just to make sure it's not too hot. You can usually dip your elbow into the water. It's a very good way to test whether the water is too hot. After washing and drying your feet, you may put some powder in between your toes. The skin in between the toes tend to stay moist, and moisture encourages the growth of bacteria and fungi. So making sure that the skin in between the toes is dry is a very good way to prevent infection. Next, if you have corns and calluses, you want to make sure that you smooth them gently. Sometimes it may be a good idea, if you have corns and calluses, to discuss with your doctor as to the best way to go about it, because if you have nerve damage, some of these corns and calluses can lead to ulcers. But as a general rule of thumb, do not cut corns and calluses. Also, avoid using corn plasters, which are those medicated pads that people place on the corns. Also, avoid using liquid corn and callus removers. Cutting and some of these over-the-counter corn removal products can damage your skin and cause an infection. To keep your skin smooth and soft, rub a thin coat of lotion, cream, or petroleum jelly on the tops and bottoms of your feet. Do not put lotion or cream between your toes because, like I said earlier, it can create a conducive environment for the growth of fungi and cause an infection. The next tip is to wear shoes and socks at all times. As much as possible, do not walk barefooted or in just socks, even when you are indoors. This reduces the risk of you stepping on something and hurting yourself. And for some people, because they may be nerve damage, you may step on something, hurt yourself, and not even realize at that point that you actually did hurt yourself. It's also definitely a good idea to check the inside of your shoes before putting them on. Just to make sure that the lining is smooth and is free of pebbles or any other objects that can potentially hurt you. Also, definitely a good idea to wear your shoes with socks or stockings, just to reduce your risk of getting blisters and sores. If you're going to do that, choose light padded socks that fit well. Your shoes must also fit well. They shouldn't be too tight or too loose. It's generally recommended when you're breaking in new shoes, you only wear them for a few hours at first and then check your feet for any areas of soreness. And if there is, then you know that the shoe may not necessarily be the right one for you. The next tip is to protect your feet from hot and cold. If you have nerve damage from diabetes, you may bend your feet and not know that you actually did. So take the following steps to protect your feet from heat. Firstly, wear shoes at the beach and on hot pavements. Don't forget to put sunscreen on the tops of your feet to prevent sunburn. Also, keep your feet away from heaters and open fires. This sounds obvious, but it's a precaution worth noting. And do not put a hot water bottle or heating pad on your feet. Also, not a bad idea to wear socks in bed if your feet get cold. Also, in the winter, it may definitely be a good idea to wear lined waterproof boots to keep your feet warm and dry. The next tip is to keep the blood flowing to your feet. Like I mentioned earlier, if you have good circulation, you are more likely to have wounds and ulcers heal faster. So the following tips will help improve blood flow to your feet. Number one is put your feet up when you are sitting. Just elevate your feet whenever possible. Wiggle your toes for a few minutes through the day. Also, avoid wearing tight socks or elastic stockings. And there's a practice that people do, holding up loose socks with rubber bands. That is definitely not a good idea. And also be more physically active. Choose activities that are easy on your feet, such as walking, dancing, yoga, swimming, or even bike riding. And another overlooked factor in terms of improving blood flow is to quit smoking. Smoking is documented to lower the amount of blood flow to your feet. So as much as possible, if you can quit smoking, you would improve your chances of improving blood flow to your feet. The next tip is to get a foot check at every healthcare visit. Ask your healthcare team to check your feet at each visit. Take off your shoes and socks when you're in the exam room so they will check your feet. At least once a year, it will be a good idea to get a thorough foot exam, including a check of the feeling and the pulses in your feet. There are some times though when self-care may not be enough and you need to call your healthcare provider. And the following are some pointers, just to kind of help you arrive at a decision whether to call your doctor. And that is, number one, if you notice a cut, a blister, or bruise on your foot that does not start to heal after a few days, that is definitely a red flag. Also, if the skin on your foot becomes red, warm, or painful, these are typical signs of a possible infection, so definitely need to take it seriously. Another reason why you may need to call your healthcare provider is a callus with dried blood inside of it, which often can be the first sign of a wound under the callus. So if you have a callus with any kind of blood inside it, definitely a red flag. And then finally, a foot infection that becomes black and smelly. Signs that you may be developing gangrene or you already have gangrene, and therefore it should be given the utmost urgency that it deserves. And in some instances, you may even ask your doctor to refer you to a podiatrist, who's generally a foot doctor, if extra care is needed. So these are some general tips about taking care of your feet if you have diabetes. I hope you found it useful. If you did, please give me a thumbs up. Also share with anybody you think may find it useful, and I will catch you on the next video. Thank you.